Maryland declares a state of emergency after 3 coronavirus cases are confirmed. Elizabeth Warren drops out of the presidential race, and President Trump attempts, falsely, to blame President Obama for the coronavirus. Today on the Diamond K Show. Welcome back to Radio on Fire. We are reporting for The Nation, episode 406 of the program. I go by the name of Diamond K. Thank you for joining me. Radio on Fire provides the best in breaking news, entertainment, and political stories that matter to you from an independent point of view. So whether you're sitting on the right or the left, it doesn't matter. We're going to talk about it, and we're going to talk about it real. So many things. Super Tuesday in the rearview mirror. 14 states across this country headed to the polls. Joe Biden, big winner there. I mean, when the bar is set so low, the bar was set so low for Joe, but he outperformed, winning 10 states of that and having a just a big showing. Crucial day. Bloomberg out of the race. Elizabeth Warren out of the race, and she had to get out of the race. I mean, she was in third place, but she got less than 50 delegates. I mean, this is just, I don't know. What is she doing? She was once the front runner. Now, she wasn't on the back of the bus, but she was there. She wasn't even in the middle. She was like near the exits, near the emergency exit. And it was really time for her to in this presidential bid. Once she was the front runner, now nobody gives a you know what I mean? It's crazy when you really think about it. Supposed to be a smart lady, former law professor, so she is smart, at least book smart, but common sense ain't common. She has not endorsed anyone and claims she's not going to do it for quite some time. Doesn't want to immediately endorse anybody. Okay, look. Your endorsement is only going to matter for about 15 minutes. You just dropped out of the race. You should endorse someone. This goes to show you how she has this overinflated version in her mind of herself, which is how she ended up in the race way too long. Way too long. Once she was the front runner. Do I need to say that? Once she was the front runner. Okay? However, she is... the focus is going to be shifted from her. So by the time she's really ready to give her quote-unquote endorsement, nobody's going to really care. But she has declined, as I said, to endorse either Bernie or Joe Biden. So interesting bit of information, not to get in her personal business, but let's go there. Elizabeth Warren, married twice, no big deal there. First husband was a Warren. He was the Warren. That's where Warren name comes from. But her current husband, his last name is Mann. M-A-N-N. Why isn't she a man? Why isn't she Elizabeth Mann? That would be a difficult name. But I'm saying, why isn't she not Elizabeth Mann? She wanted to keep the surname of her first husband. Super weird. Dated this woman one time. And she was going to try to keep her first husband's last name. Because she said, my kids have this last name. I don't want to take them to the school and then I have a whole nother last name and whatever. It's just crazy. So Elizabeth Warren uses her first husband's last name and she achieved a lot of success, a lot of her accreditation as a Warren. So she didn't want to be Elizabeth Mann. Okay, random information. Just wanted to throw that out there. But Elizabeth Warren is now on the sidelines, watching the cars go past. A lot of stuff that she can do. She did not win her home state. Okay, came in third in your home state. That has to be a bruise to the ego, a reality check, she had a plan for everything. She got a plan for that. What is her plan now? Hopefully her plan is that she's going to try to keep her job as a senator. Who knows? I don't know what she's going to do. But it's ironic considering where she's come from to where she is. I'm sure that it was very disappointing. Experts were predicting something else from her, but now, it is what it is. The fact that she's not going to endorse anybody, I think, is very. It's sad to me because she still thinks that she has a position that she does not have. You know, she has a position she does not have. That, you know, we are seeing the end of her. The end of her. Maybe she was too young. She's 70. You know, the other guys are way older, going on 80. Maybe she needed to wait a few more years. Very interesting. So, of course, you just tuned in. Diamond K. It's the Diamond K Show here on Radio on Fire. Let's take a quick break. Let's come back and talk about Maryland declaring a state of emergency as 3 coronavirus cases have been confirmed. Take a quick break. We'll come back right after this.
Do you have a business, product, or event that you need to promote to men and women ages 23 to 44? If so, Radio on Fire can help you do it with one of our promo packages. Our broadcasts reach over 150,000 people per month. Sponsorship for one or all of our radio programs can include live mentions, social media posting, commercials, and more. Visit radioonfire.com/advertise to find out more about a promo package that fits your needs. Rates start as low as $50. If you want to reach men and women ages 23 to 44, log on now, radioonfire.com.
So if you want a real meal, that's delicious. I know about noodles. I grew up on noodles. Now I created my own brand. It's nothing like this. See this? The Icon brand. Chicken and gumbo. Real New Orleans flavor. I used to go, the 99. Now I'm going, delicious. If you ain't eating wrap noodles, then you shouldn't be eating noodles. Because this is the best of the best noodles. Those other noodle companies have nothing on us. We wrap noodles. We the King Kong of noodles.
Welcome back to the Diamond K Show here on Radio on Fire. Of course, your man Diamond K in here. Radio on Fire, we are reporting for the nation. Maryland, Governor Larry Hogan has declared a state of emergency today as 3 Montgomery County residents have tested positive for the coronavirus. Officials stated this evening the patients who contracted the virus while traveling overseas are in good condition and are isolated in their homes. That's what officials said. 2 of the patients are a couple in their 70s, and the third is a single woman in her 50s. They returned to the U.S. on February 20th, the officials say. So, here's my issue, and I have one. Does anybody remember the boat, the cruise, the Grand Princess cruise that was, off the coast of California, Limbo, the one that was there for, the trip February 11th to February 21st, that trip? Were these people from that cruise? Because the dates really line up. And we don't know what happened to the 100-some people that were aboard this Grand Princess cruise that live all over the country. And now all over the country, we have different states declaring a state of emergency. And we have people that lived in this country, and they're saying all these people, no one contracted it in the U.S. They all contracted it somewhere else. We have a bunch of people that were on a ship, and now we have all of these cases from people who they claim were on ships. Why were these people handled in this way? Why are they back here home when they are not well yet? Very close to Washington, D.C. I'm sure it's going to make a lot of people nervous. Virginia has not confirmed any cases. Washington, D.C. not confirmed any cases. Maryland has 3 cases. This is not good. This is This is not good. State of emergency. Let's talk a little bit about a state of emergency. What is a state of emergency? What exactly constitutes a state of emergency? A state of emergency is a situation where the government is empowered to perform actions or impose policies that they do not normally do. Now, a government takes actions like this: civil unrest, we know about that, armed conflict, disasters. These kind of alerts to citizens change or should change normal behavior and orders the government agencies to implement emergency plans. So that's the thing about this. This is a pretext for something. We don't know what yet. How are you going to institute a state of emergency, as the governor did, Governor Larry Hogan, and then on the other hand, you're going to tell people that, nothing to see here, go about things normally? Why would they institute a state of emergency on a Thursday night if it was not something serious? They could have waited till the morning. If it was no serious, there was nothing to see here, you didn't need to break through and do it in the middle of the evening on a Thursday. So this is a pretext for something. What is going to happen, we don't know. The use, what is the purpose? Why declare this? It's very interesting. And I tell you what else is ironic is that Larry Hogan, the governor, has been trying to put forth some bills with the help of some Maryland Republicans for them to have power of state of emergency over Baltimore City as it relates to crimes. So then it's very interesting that the state of emergency being instituted in Maryland over these cases. And so this is something that is very worrisome to everyone. And so we have this COVID-19, which the coronavirus, what they're calling the coronavirus. The governor said that we have been actively preparing for this situation over the last several weeks across all levels of government. I encourage all Marylanders not to panic, but to take this seriously and to stay informed as we continue to provide updates. Does that constitute a state of emergency? And speaking of state of emergency, I will say this. Larry Hogan, Republican from Maryland, I think that he is better suited to handle a crisis than the mayor of Baltimore, who up until 6 o'clock p.m. was tweeting out there were no cases in Maryland. This is the mayor of Baltimore City. So the city of Baltimore and the Baltimore City Health Department are working closely with the state health partners as Maryland faces the first confirmed cases of the coronavirus. Jack Young said that after the announcement was made. Speaker of the House, the Maryland House of Delegates, Jones, and Senator Bill Ferguson issued joint statements Thursday night praising Hogan's quick response. They said that we want to thank the governor and the Department of Health for their quick response and focus on these cases, and are ready to work together to confront this issue and make sure to align the best public response in a calm, collected manner. We have the best health professionals in the world and have complete confidence in the ability of the medical community and the state and local governments to work together to contain the effects of the COVID-19 virus. There was a news conference, a brief one. And, so you want to prepare for things, of course, and we're here. So we have 3 cases that we know of in Maryland right now. That is probably going to increase. It is probably going to increase. So what can you do? What can you do to protect yourself, your family, your community? What can you do? There is no vaccination, no vaccine. There is nothing right now. There's nothing. That process could take longer than 1 year for a vaccine. The president, Donald Trump, visited the National Institutes of Health in Bethesda earlier this week. He visited the Vaccine Research Center, where he participated in a roundtable briefing. The president, you know what I mean? So they're warning people of all kinds of things. They're letting you know you need to wash your hands. Obvious, but you need to wash your hands 10 times more than you normally do. Stop touching your face. Stop it. Stop touching everything. And letting people know in church, none of that crazy stuff, right? Just keep your hands to yourself. No church hugs, none of that stuff. You really got to understand how serious this is, and just becoming prepared. Hospitals in Maryland are prepared and said that everyone needs to take precautions from getting sick, right? So what does that mean? Of course, that's something obvious, but that means how things are transmitted through touching infected items. You know, we have to be more cognizant of these things. So a lot of times you'll touch a table, you'll touch your face, you're touching your clothes, you know, all kind of stuff. We've got to. I think that we need to be prepared. It's just going to be a matter of time before this spreads even further. And so they want people prepared but not panicking. So there's a fine line to prevent getting any virus. The same rules of good hygiene are going to apply. Wash your hands, use hand sanitizer frequently. Don't cough into your hand. Use your elbow if you're sick. Stay home. If you are sick, stay home. Now, you got to be careful of some of the hidden areas that harbor germs. Doorknobs, gas pumps, cell phones, keyboards, your computer keyboards. So these are all things. Interestingly enough, they talk about saying that face masks will not protect you from getting sick, but will protect others from getting your germs. Okay. Sinai had to move their masks behind the information desk because people were just grabbing handfuls at the entrances and just bouncing. You know, I'll take that. On a daily basis, hospital staffs are taking these normal precautions for any illness, including face masks and eye protection. So we don't want the people in the hospital getting sick. The worst thing that can happen with the COVID-19 virus is it spread in a hospital. But as the weather gets warmer, many of these viruses like this are going to die off. Now, you can still get a summer cold and all of that kind of stuff, but the coronavirus is new, so people are not sure if this COVID-19 is going to taper off as the weather breaks. Ironically, this Sunday, daylight savings time is over. You know what I mean? You know what you say, there's a spring forward and fall back, right? So we're getting ready to spring forward. It is getting ready to really break into that springtime. So new cases may expand quickly. There's no telling where things are going to go from here. But this coronavirus has people nervous, and rightfully so. Rightfully so. As I said, just tuning in, Governor Larry Hogan confirming 3 cases of the coronavirus in Maryland, and 7 new Maryland patients are being tested for possible coronavirus. That could be some type of a peek into why a state of emergency was declared in Maryland on March the 5th. But as I said, according to these health officials, the 3 patients are a married couple in their 70s and a woman in her 50s from Montgomery County, Maryland. These 3 patients traveled abroad to an undisclosed country with the same group. They all returned on February the 20th and took themselves to the hospital for treatment. What happened to them in the hospital? What did they do in the hospital? Who did they come in contact with? We don't know. 3 patients weren't contacted by authorities until Tuesday after they went to the hospital. Why are we just finding out today? I don't know. How are they going to say that the patients are in good health, but at the same time, they got a coronavirus? It's like contradicting. It's like you're full, but you're hungry, right? You're wide awake, but sleepy. You know what I mean? They're in good health, but they got a coronavirus and they're in their damn house, okay, after coming to the hospital. Governor Larry Hogan declaring this state of emergency. He says to speed up additional resources. They trying to get that money is what he's saying. State of emergency is going to unlock certain things. He said that. I'm just telling you what he said. All right, he submitted a $10 million supplemental budget to combat the coronavirus earlier today. With the state of emergency, they're supposed to get that money. What is this money used for? What? Does Larry Hogan own some money in masks and gloves and hand sanitizer? He's trying to get some of that money, allegedly. I don't know, allegedly. The city of Baltimore and the Baltimore City Health Department, something that unfortunately for us, Jack Young is partnering with. I don't feel good about our chances while Jack Young is the mayor. I don't feel good about the chances. I mean, could anybody feel good? I mean, people in Jack Young's house don't feel comfortable with Jack Young in control of the finances and the. Let's keep in mind that Jack Young's acting like, okay, Baltimore, we got everything under control. They screwed up. Do you remember when our systems got hacked? Remember that? He screwed that up. But we supposed to feel that they're going to be able to handle the coronavirus? And let me quell some people's fears with this. You have a better chance in Baltimore of a homicide happening than you actually getting the coronavirus. Let's look at the ratio right now. 300 some murders. We don't have 300 cases of coronavirus, right? The chances, I'm not going to say chances are low. The chances are lower. But they are rising, but it's not there yet. But I'm more concerned about the spread of this if it gets into a hospital or a school. Then, we're going to be looking at some rising numbers. But if people exercise proper hygiene, I think that this can be minimized. There's going to be a spread, but it can be minimized. There's 7 more people that they have not released status on, and we're going to have to follow that closely and see what happens with that. Hopefully, we're not talking about something that's going to really, really get to levels of China. But I'm very concerned about this Grand Princess cruise ship that was in limbo off the coast of California. A former passenger became the state's first known person to die from the COVID-19 virus. And health workers say that they will now test some current passengers to determine whether they have the respiratory virus. That is the COVID-19. They said that they're going to be flying test kits to the cruise ship and sending those back to the state quickly. So you got those people that say, "Oh yeah, you did your passport. Hey, you always trying to go over here. I'm trying to go. We taking trips, and they trying to floss on people, right? Now look at you. You need to stay home, okay? You need to stay home. State of emergency in California yesterday. State of emergency in Maryland today. There will be other places with the state of emergency. Now, the passenger who died was an elderly man exposed to the coronavirus during a trip from San Francisco to Mexico in the middle of February. Now, health officials are tracking down thousands of people who were on the same trip who might have been exposed to that virus, so that might be something else. As we're going to be seeing the effects of now. The man was on the ship from February 11th to February 21st, very seemingly, interestingly close to the February 20th that they're saying that the 3 people from Maryland that have the coronavirus re-entered the U.S. So very interesting, and they were also on a cruise. So that's very interesting. The Grand Princess was carrying around 2,500 passengers and normally has some 1,100 crew members. The cruise line says that only a small fraction of that number will be tested, with the remainder of the people on board told to monitor themselves for any symptoms. You're like, let us know if you need any help. They're only testing a small amount of people. So what their idea is, they don't want to bring in any kits because they're trying to keep the profits that they made from this cruise. So just stay in the room for 2 weeks and we'll let you out in 2 weeks. It's horrible. It's horrible. So fewer than 100 guests and crew were identified for testing. All those people, 2,500 people, they're only going to test about 100 people. Number includes passengers who were on the vessel for both the Mexico and Hawaii cruise, Aloha, as well as people with flu-like symptoms. Now, guests generally under the care for respiratory illnesses. So they're taking people on the honor system. You feeling hot? You good? All right, cool. We ain't gonna worry about him. This is ridiculous. This is ridiculous. In a letter that was sent to current passengers who were also on the earlier trip, Princess Cruises informed them the CDC requires you to remain in your stateroom until you have been contacted and cleared by our medical staff. See you in 2 weeks. The exact date and time of the ship's arrival was to be determined. As of lunchtime today, the Grand Princess was about 100 miles off the coast, headed towards San Francisco. According to the maritime tracking site, Vessel Finder, cruise ship won't be allowed to dock until the coronavirus testing is complete. But wait, everybody ain't being tested. They only tested 100 people, right? This right here is going to create a major problem. This is going to create a major problem, having people on the honor system. There is no honor. They're trying to get off the damn ship, right? On Thursday, San Francisco announced its first 2 COVID-19 cases. That was a man in his 90s who was hospitalized in serious condition and a woman in her 40s who was hospitalized in fair condition. Both tested by the state of public health on March 4th. They were likely infected through community transmissions, as they have had no known contact with anyone who traveled to outbreak locations. So they got that in the city, which is no surprise considering how they're handling people who have possibly been infected. You good? You hot? You all right? All right, you can go ahead. Go ahead and go to the market in the hospital. No problem. It is... Really, I'll tell you what I ain't rocking with, and that is the Grand Princess and the Princess Cruises. I ain't rocking with them. Definitely ain't rocking with them, and I'm not trying to go to Mexico no time soon. California health agencies are currently monitoring at least 9,400 people in 49 countries who were potentially exposed to the coronavirus through air travel. And that's travel to some of these countries that are on the banned list. There's a banned list. Don't go to those countries. That's what they're saying. So, evacuation flights from Japan, China, where the virus was first detected. It is on and popping, as they say in China. On and popping. California, state of emergency. Maryland, state of emergency. Your man Diamond K in here Radio on Fire. Death toll in the U.S. has risen to from 9 to 11 people after reports of these fatalities in California and Washington State yesterday. So, I don't know. I think that this comes down to a lot of things. This comes down to general hygiene, but this also comes down to our elected officials and leaders handling this correctly. That's what it comes down to. Man, Diamond K, let's take a quick break. Come back after this with more of the Diamond K Show. And we are back. Radio on Fire, your man Diamond K. Instagram, Facebook, Twitter, at The Diamond K Show, at Radio on Fire. At least 130 confirmed and presumptive positive cases of COVID-19 in the U.S. right now. More, and it's climbing. It is climbing. So, the President of the United States, sometimes it is still shocking that Donald Trump is the president. Sometimes it is still shocking. Trump incorrectly blamed an Obama-era policy for the delay in testing. 4 years after President Obama's gone, he's still on crybaby politics. Crybaby politics is very frustrating. Bernie Sanders traffics in crybaby politics. But let's stay focused on Donald Trump for a moment. President Trump is falsely blaming the Obama administration for the slow rollout of U.S. tests for the new coronavirus, ignoring his own administration and their fumbles in responding to the health crisis, mischaracterizing things as an Obama-era policy. He's been in office for 4 years. How is it possible that you're still blaming President Obama? His comments delivered outside of the White House, it's unbelievable. The Trump administration, of course, facing sharp questions. They're giving false information, wrong information. The Center for Disease Control and Prevention has acknowledged that its initial test kits didn't work. The initial test kits did not work. That's President Obama's fault. The new tests were needed, and that delayed the government's ability to detect and contain the spread of the virus. Now, let's keep in mind that one of the first things that President Trump did when he got in office was gutting out the various agencies that could help with this. Various agencies. But anyway, he says that the Obama administration made a decision on testing that turned out to be very detrimental to what we're doing. It's just, grown man. This is a grown man. Grown man. So there's never a cry. If Trump's marriage fails, right? This third one, he's going to blame Obama for that, right? He's going to blame Obama for everything. It's crazy. So we have to hope and pray that people are using common sense, staying calm, washing your hands, and just taking a common sense approach, precautions in the wake of this coronavirus. Man, Diamond K, I will be back here tomorrow, 7 p.m. Also next week, we're going to be on the road in Atlanta. Of course, the program's still coming, providing the best in breaking news, entertainment, sports, and political stories that matter to you. To get all show archives and exclusive content, become a member today. RadioOnFire.com/join. It is Radio on Fire. We are reporting for the nation.